Thank you, Andy, and thank you for members of the media for joining us today. As always, I'll start with some numbers and then I'll have some opening remarks. As of this morning, we have 53 total inpatients in our system being cared for COVID-19. 4 of those are at A.R. Gould. 37 of them are Eastern Maine Medical Center. 3 are at Maine Coast Hospital. 3 are at Mayo Hospital. 4 at Mercy Hospital. And 2 are at Sebasticook Valley. In addition to that, our home care and hospice team are taking care of 4 patients at home with COVID-19. Our COVID positivity rates remain exceedingly high. Our 2-week positivity rate now stands at 9.04%, and the 1-week rate stands at 9.41%. To kind of put those in perspective, again, about this time last year, we were less than 0.5% for a positivity rate. New this week, we are sharing an infographic with you on our social media pages that gives a snapshot in time of our number of hospitalized patients with COVID-19 and their vaccination status as a way to share vital information with the public about the effectiveness of vaccines in preventing hospitalizations, severe illness, and death. Again, we should point out that these numbers represent a snapshot in time, and ICU capacity in particular can fluctuate very quickly. But in this graphic, you can see that as of September 1st at 12:01 a.m., out of the 47 hospitalized patients with COVID-19, 44 of those were unvaccinated, 3 were vaccinated. Out of the 26 patients in intensive care, 25 were unvaccinated and 1 was vaccinated. Out of the 9 patients on ventilators at that time, all 9 were unvaccinated. We hope that this data helps inform those who may be hesitant about vaccination that vaccination is our best way to protect ourselves and others. I would like to point out that while vaccines alone won't prevent all infections or eliminate the virus, that has never been the goal of vaccination. The goal is to prevent severe hospitalizations and death, and widespread vaccination could turn COVID-19 from the current pandemic into a disease we can manage without tremendous loss of life, economic hardship, or loss of social activities. I also wanted to bring a brief update about ivermectin. Ivermectin is a U.S. Food and Drug Administration approved prescription medication used to treat certain infections caused by internal and external parasites. When used as prescribed for approved indications, it is generally safe and well tolerated. During the COVID-19 pandemic, ivermectin dispensing by retail pharmacies has increased, as has the use of veterinary formulations available over the counter but not intended for human use. The FDA has cautioned about the potential risks of use for prevention or treatment of COVID-19. Ivermectin is not authorized or approved by the FDA for prevention or treatment of COVID-19. The National Institutes of Health COVID-19 Treatment Guidelines panel has also determined there are currently insufficient data to recommend ivermectin for treatment of COVID-19. Adverse effects associated with ivermectin, misuse and overdose, and more people experiencing adverse effects. So please, anybody who's having any symptoms, please call Poison Control Center as they have been responding to these calls. And with that, I'll turn it over to Paul for an employee update.
Thanks, Dr. Jarvis. So I'm pleased to announce that on Monday of this week, we surpassed 88% of our staff being vaccinated. We continue to work with our staff who remain unvaccinated, that 12%. And focus on Johnson & Johnson vaccine, of which we have availability, and also those who are interested in the Pfizer vaccine, even though the state mandate of 10/1 they would need to take some time off in between 10/1 and the date on which they're fully vaccinated. That's still a viable option for our staff. So we have vaccine doses available. We continue to work with staff to answer any questions of hesitancy or concern, and are encouraging them to speak with their own providers as well in that regard. And so we continue to vaccinate our staff at a very quick pace. As soon as they're interested, we're interested in vaccinating them. And we have vaccinated about just shy of 10% of our employees, that gap of folks who were not vaccinated between the 3rd week of July and the end of August. So in that 5.5-week span, we vaccinated about 1,200 of our staff, and we continue to vaccinate more every day. Thank you.
Thanks for that update, Paul. And now we'll turn it over to Andy to get questions from the media.
All right. Thanks, Dr. Jarvis. Thanks, Paul. To get us started today, we have WABI, Brittany. You should be able to unmute now.
Thank you very much. And this question is for Dr. Jarvis. Dr. Jarvis, we've had a couple of calls and emails to our station from people confused about the difference between the, I'm sorry if I say this wrong, Comirnaty versus the BioNTech Pfizer vaccine. So could you tell us if there is a difference, what is there, and why was one of them approved and one still under the emergency use authorization?
Yeah, so that's actually a great question, and it really has to do with the way FDA approval goes. So first and foremost, those are the same vaccine. So they're both the Pfizer vaccine, and the one that we've called the Pfizer vaccine all along. There's no difference in the components of it. It's just that once a product is given FDA approval, the company can then market that product, and when they market it, they usually go from whatever the generic name or the scientific name is to use a more common name. We can debate whether that particular name works or not, but it's just a matter of course. There's no difference between them, and that's so when it says it has FDA approval, they're just allowed to rebrand it. So that's just the same as we see with any other medication out there. Great question, Brittany.
Thank you very much. And my second question also has to do with vaccines. We have seen in the last 2 weeks that Maine is up significantly in its vaccinations administered. And I'm wondering if you have any sense of why that is. Is it the mandate? Is it the approval? Is it a combination of all of the factors? If you could weigh in on that, that would be great.
Yeah, that's a great question too. So the question was, we've seen an increase in vaccination rates here in the state of Maine, and why do we think that might be? I think it is multifactorial. I think it's a matter of the fact that we are talking about this Delta variant and how severely ill people are becoming with the Delta variant, and how many more positive cases we are seeing. Like I said at the beginning of the briefing, this is a dramatic turnaround from 12 months ago. 12 months ago, we were seeing very low rates as we started the school year, and now we're seeing exceedingly high rates, and that's concerning, obviously. So I think it's that. It certainly is the discussion that many factors of our society are having around vaccination. While the state does have a mandate for healthcare workers and certain other first responders and people that deal with the public, we know that there are private businesses that are also requiring their staff to become vaccinated. And I think all of that just plays into a positive sign for us that we are seeing increase in vaccinations. Throughout this entire process of vaccination, Maine has led the way, and I'm encouraged by the fact that we are seeing more individuals in our state become vaccinated.
All right, thank you, Brittany. Next we have WVII David, and David's having some problems with his mic, so he sent me his questions, and I can read them to you. This one's for you, Dr. Jarvis. David asks when the booster shot will be available and who will be able to get it.
Yeah, so again, there's a little bit of confusion around booster shots right now. They'll try to clear up some of that. One is talking about the third dose for people who are immunocompromised, and for that, it's a very narrow definition of individuals who are immunocompromised. Most of them are on some kind of treatment or suppressive drug that makes them immunocompromised, or they're at higher risk because they have had a recent cancer or a solid tumor transplant or solid organ transplant. I apologize for that. That's really basically an additional dose to that original series of the 2 shots for either Pfizer or Moderna. As far as booster shots go, which is for the general population, there's still a little bit of uncertainty there. The administration had discussed starting to do booster shots for individuals who had been vaccinated over 8 months prior at the end of this month. However, the Advisory Committee on Immunization Practices discussed that over Monday and Tuesday, and right now their guidance is that they are looking for some more specific information from the CDC and data before they make a recommendation either for or against booster shots. Here at Northern Light Health, we are anticipating that booster shots will be necessary and are making plans that if and when that comes, that we will be able to administer those vaccines in a safe and timely fashion, and trying to make it as convenient as possible for all Mainers to get that booster shot. Right now, our efforts, however, continue to be focused in on those who are unvaccinated and trying to encourage them to listen to the science, to reach out to individuals who they trust, and to get vaccinated.
Okay, and then for his second question, he's wondering what your thoughts are on schools allowing students who get the vaccine to not wear masks as a way to incentivize those who are not vaccinated. So
Yeah, currently I still recommend following both the CDC and the main CDC's guidance around masking for those who are both vaccinated or not vaccinated. Right now, the CDC's guidance for in-person learning in schools is that everyone, students, teachers, and staff, should be masked while they're in school. As far as out in any other location, really it has to do with the positivity rate or the rate of disease in a community. And unfortunately, most of our counties now are in a substantial or high positivity rate in the state of Maine, and therefore the guidance is all people should be wearing masks while indoors in public places, regardless of whether they are vaccinated or not. And so I support that. I think there are other ways for us to talk about incentives. The biggest incentive, of course, for vaccination is that it helps to keep not just yourself well, but for everybody else around you well. And that will mean keeping kids in school for the entire school year, which is so important. We at Northern Light Health certainly support in-person learning for our students, and we want to see that they go to school safely and that they can continue that in-person learning throughout the entire school year. So thank you for that question.
All right, next we have Maine Public. Charlie, you should be able to unmute now.
Yep. Hey, this question is for Dr. Jarvis. And this is my only question. Can you share how much of the hospitalized COVID-19 population at Northern Light Hospitals is from rural areas now? I recall that they represented a pretty big chunk in the recent memory, but where does that stand right now, and any other details you might be able to provide about that?
Yeah, so I think it's still it's a disproportionate number of people who live in rural communities who are being hospitalized right now. I looked at the numbers this morning. I can't give exact references, mostly because we start talking about smaller populations, and we do have privacy issues that we want to protect our patients with. But yes, it is a disproportionate number of people who live in rural communities, and it really mirrors the same communities that have a higher rate of unvaccinated individuals.
Thank you.
Charlie, did you have a second question? All right.
Just one question. That was all I had. Thanks.
Okay, thanks. Next up, we have Eric Russell, Portland Press Herald. Eric, you should be able to unmute now.
Good afternoon. Thank you both for taking the time. I have one question for each of you. The question I have for Paul is, can you talk a little bit about employee morale and burnout? I know there's been a lot going on with both the difference of opinion among some for the vaccine mandate, people being exposed to COVID in the workplace, and just general burnout from doing this for 18 months. What's your sense of how the staff is handling all of this with the recent surge in hospitalizations, particularly?
So our staff, really, I can't stress enough how fantastic our staff are. Resiliency is really the key in this long pandemic. We're in 18 months, as you mentioned, and so we're doing everything we can and to support our staff in terms of providing support directly through our Healthy Life resources and employee assistance programs in terms of group sessions and individual coaching and counseling. We're having stress relief events to the extent they're appropriate in care settings. We're trying to keep things as normal as we can. For example, next week, some of our locations are doing sort of a socially distanced barbecue with to-go food to try to keep things distanced and safe, but as close to normal as we can get them. Also, really peer-to-peer support is so critical in this time, and so working with people who are concerned about others not being vaccinated, people who are not vaccinated who have concerns about vaccine and questions. All of those are fair game topics that Dr. Jarvis and I and others host regular forums with staff from across our system to invite questions, comments, and provide fact and data to refute some of the misinformation that's out there. But certainly, this is hard work. Healthcare has always been hard work. It's a calling. But it really is dependent upon staff leaning on one another. Northern Light has been leaning in throughout the pandemic to support our staff and make changes to our benefits and other policies to make things as easy as possible for staff to continue to navigate through the pandemic with us. And we continue to do that, and that continues to be our approach as we try to vaccinate our staff as well. We see that as the best protection to keep staff healthy, which is critical to our ability to continue to care for patients and one another.
Thank you. And the question I have for Dr. Jarvis, you touched upon this a little bit last week when we were talking about hospitalizations increasing at a pretty disturbing rate. I wonder if there have been any additional conversations about whether it's eliminating some elective procedures that might require hospitalization, whether it's, planning more for off-site beds or that sort of thing. Can you give us an update on those discussions that might be happening?
Yeah, so the question is, what are we doing in case that we continue to see increases of hospitalizations, whether those be for COVID-19 or otherwise? So Northern Light Health has reinstituted its incident command on a more regular basis than we had been doing. And many of our member organizations, including at Eastern Maine Medical Center, they have done the same. And so on a regular basis, we have senior leadership who are reviewing what's going on across our system and adjusting as we need to. As I have said before, we do have plans in place for any event that would require a major number of people being hospitalized, and we can certainly utilize those if we have to. In addition, we continue to evaluate what our needs are on a day-to-day and sometimes an hour-to-hour basis, whether that be taking an individual who has a non-urgent procedure and delaying that for a period of time. Thankfully, we have not had to do that very often, if at all, at most of our member organizations, but it is something that we look at and review. But it is concerning. As of today, this morning, Northern Light Health, our 10 member hospitals, had very few open beds available to us. Some of this has to do with just the seasonality that during the summer months in Maine, we see an increase in our hospitalization rates as we see an increase in our population due to tourism. But a lot of this has to do with the fact that we have people that are in our hospitals with COVID-19 who would otherwise not require hospitalization, and that just taxes our services even more. And many of those individuals, particularly those in critical care, are requiring such a large amount of staff resourcing that makes it hard for us to continue to manage elsewhere. So we continue to monitor and look around the state and actually look outside the state, which is a shame. Many people have to travel far in our state just to get to a major medical center. We'd hate for them to have to travel outside of the state. So let me once again say, if you are unvaccinated, please reconsider your thoughts and get vaccinated so you can protect yourself and protect those that you love and the communities that you live in. Because if we run out of hospital beds, we won't be here for the next heart attack or a motor vehicle accident, or a woman who needs to deliver her baby in a safe environment, or a child who needs our care desperately. We are pleading with you to help us so we can continue to help everyone else. So thank you for the opportunity to answer that question.
All right, next up we have WGME. Marissa, you should be able to unmute now.
Hi there, thanks for taking our questions today. I do have two questions. First, what would you say to healthcare workers who don't want the vaccine, not necessarily because they're against vaccines, but because they don't like the fact that they're being forced to take it?
Yeah, I think, for me, everything is an individual choice. For myself, I follow the science, and the science leads me to believe that the vaccines currently authorized and approved for fighting against COVID-19 are both safe and effective. I want to keep myself safe, I want to keep my family safe, and I want to keep my patients safe. And so that's where I am at, and everybody needs to make that decision themselves, and I'm sure Paul has some thoughts as well.
Sure. Yeah, thanks, Dr. Jarvis. It's a great question, and it's one that people have asked us. Staff have asked us, and I always reiterate what Dr. Jarvis says. Certainly this is a choice, but healthcare is a calling. Regardless of whether you're in an administrative role, a direct patient care role, we're either caring for patients directly or caring for those who do. And so caring for people requires protecting yourself and them. And that's part of being a healthcare worker, and we see that as a critical component of the healthcare mission, regardless of the job that you have and what you do. But that said, we still focus on providing information in detail because people have questions. There's so much misinformation out there. It's unfortunate, and our job has been focused on dealing with misinformation and dealing in fact and data, as well as stories. We've had very compelling stories shared by some of our staff with their colleagues. Just yesterday, one colleague shared that she has already lost one close relative who was in their early 40s due to COVID, who was otherwise very healthy by all accounts prior to the disease, and another one who was on a ventilator at this time and has a very questionable future. That was a very moving commentary by that colleague of ours, and it's those types of stories that people need to hear about so they can make an informed choice for themselves and their family. And we think that certainly most people are voting with their arms in terms of becoming vaccinated, and that's what we want our staff to do.
And kind of on that same note, how is Northern Light enforcing that mandate internally? And also, what would you say to providers who plan to hire and retain staff that are unvaccinated?
So we're following the state's requirement for healthcare workers to be fully vaccinated by October 1st. That includes vaccinating folks now either with the Johnson & Johnson vaccine, which is one single dose for the initial series, or Pfizer, which is 2 doses. If folks are not fully vaccinated by that time, we're removing them from the schedule in order to be compliant with the state mandate. We're seeing more and more people every day change their mind who were earlier hesitant or not interested in becoming vaccinated. So we continue to be optimistic that more folks will change their mind and become vaccinated, and we don't wait. If employees are interested in becoming vaccinated, we have it available 7 days a week.
Oops. Thanks, Marissa, for your questions. Next up, we have Bangor Daily News. David, give me just 1 sec. Okay, David, you should be able to unmute now.
Thanks so much. I had 3 questions that I had sent in. The first one is, Penobscot County makes up 11% of Maine's population, but has seen 1/5 of new COVID cases since the beginning of August. My only question is why? Why are we seeing the surge in this county?
So for the most part, Penobscot County is highly vaccinated, but we know we have more rural communities where unfortunately vaccination rates are lower, so that certainly plays a role in it. Bangor is an urban center, and therefore there are activities that happen here that put people in close proximity. Beyond that, I have no other specific rationale or reason for that. And I think it's just a matter of where right now community spread is highest.
And this kind of goes to my second question. So do you feel like the Penobscot County's rural populations, the ones that are seeing some of the low vaccination rates, do you think that's driving these numbers increasing?
It certainly is the unvaccinated individuals that are driving the increase in our positivity rate. There is no doubt about that. And particularly because of the Delta variant and the fact that it spreads much more rapidly from one person to another. Many recent studies have talked about that, even within households, one family member spreading it to other members in the household has gone up significantly since the Delta variant has become the dominant strain in the United States. And here in Maine, it's more than the dominant strain; it is the predominant strain, meaning that there are very few other strains here in the state of Maine right now.
All right, David, thank you. Next up, we have Penobscot Bay Press. Leslie, you should be able to unmute now.
I did unmute. Thank you. I have one question for Dr. Jarvis. I happened to glance at the New York Times this morning, and there was a story that said the Delta variant is waning, and it apparently is following the same pattern that other viruses or the other coronaviruses follow, with a kind of a 2-month surge and then dropping off. And I wonder if you could comment on that.
Yes, that's pretty typical for respiratory viruses, and we've been saying that we would see peaks and valleys probably going forward with coronavirus. Unfortunately, the Delta variants did more than just a peak. It's a surge that's rivaling our worst days from last winter time, and so that's a concern. It does look like there are certain parts of the country where they are on the downslope. That is not the case from our internal data here in the state of Maine or across Northern Light Health. We continue to every day see an increased number. And as typical for respiratory viruses, Maine lags behind the rest of the country. In some ways that's good for us because we can prepare for what's coming. But in other ways it means that we hear things like, oh, things are getting better, except that in Maine they are not. It takes us a while. We're at least 2 weeks behind the rest of the country when it comes to what the Delta variant has done for us. And so unfortunately that does not bode well for the next 2 weeks in terms of hospitalizations and overall cases. And most of our predictive models do continue to say that Maine will see an increase at least for the next 2 weeks.
Thanks. That's all I had.
Thank you.
All right, thanks, Leslie. And next we have New Center, Maine. Bob Evans, you should be able to ask your question now, Bob.
Good afternoon. My first question is for Paul. Paul, you mentioned the 88% of the staff that is now vaccinated. With hospitalizations up, aren't you concerned that the vaccine mandate will force out some of the 12% left of the already strained workforce that you have right now? And have you already lost employees over the issue?
Sure, we've lost some employees already. Small number, I believe 20 or 23, I think is the number of people who've decided to leave at this point. But I know that of the 12% who remain unvaccinated, what we saw during the surge of COVID a year ago, we had times where we had 450, almost 500 employees out who were quarantining or ill. And so that's a significant percentage of our employees as well. So we know that 12% of our employees is a large number. I don't expect 12% of our employees to leave. I expect a large portion of that group to become vaccinated by the state mandate. But I do think that it's important to know that if we have unvaccinated staff, those staff are incredibly susceptible to becoming ill themselves, which takes them out of the workforce also. So in terms of workforce continuity, a fully vaccinated staff is much more resilient in avoiding COVID and sharing it with others. And so we see that as a double-edged sword, but vaccine is the way to go. And if folks decide to leave, that would be very unfortunate. We don't want to see that happen, but if it does, then we will need to adapt, as we always do. But our focus, again, is having vaccinated staff is better than unvaccinated staff, and we continue to make that effort to vaccinate our employees.
Thank you. My next question is for Dr. Jarvis. Dr. Jarvis, do you think the vaccine for children that is spoken about a lot now is imminent? Vaccine for children.
Yeah, that's the question that's on my mind more than I think booster shots, especially as children go back to school last week and this week. We just don't know the answer to that. We continue to hear that it probably won't be until the winter, but things can change rapidly in the COVID world, and it really just depends on how much data both the FDA and the CDC receive, and then what the independent groups that review that data, what their thoughts are. Again, remember, for children, safety is certainly the #1 concern, and they want to make sure that the vaccines are safe, which we feel they will be. There's usually not much difference between adult vaccination rates and harm and children vaccination rates and harm. But then, of course, we want to make sure they're effective as well. And so I think that's still a data collection. I'm hopeful that we'll be talking about it more fall, early winter rather than late winter, but only time will tell.
All right, thanks, Bob. Well, it looks like we've gotten through our list of questions, so we can wrap it up now. Thanks, everyone, for attending today and helping us get the word out. As we mentioned before, and as Karen and Chris noted in the chat, we have the high-quality video file available. Just let us know in the chat or email us if you haven't already, if you'd like that. That graphic that we shared earlier and that Chris provided you in the chat, we'll send that to you via email as well after the briefing today, so you'll have that and can use it. That should come your way in just a few minutes. So with that, I think we'll let Dr. Jarvis have the last word.
Once again, thank you so much for helping us to get our message out. As football season starts, I'll use a little bit of a football term. We're in crunch time now. If you are out there and you are considering getting vaccinated and have been on the fence, this is the time to do so. It is vitally important that we protect as many of our Mainers as we possibly can, and vaccination is just one of the tools that we have, and in fact right now the most important tool to help prevent the spread of this deadly disease. So thank you all for everything that you're doing out there. Stay safe, be well, and we're here for you when you need us.
Thank you.